Hello.
Hey everyone!
Happy
Friday! Woo! And happy 7th anniversary, Jess!
It's that late. 7 years, man.
She's been here almost as long as Dr. Sukar.
Yeah. Just kidding.
So, welcome to our second post of the PS
With
show.
Ash and Jess.
Yeah. Thank you for. So we had a long conversation about should Ash go first, should Jess go first, but she has children, so she was already prepared to give me what I wanted.
Yeah. So we let Ash go first.
So we'd love to keep doing these little videos for you and covering different procedures, answering your questions, having guests on. So please, if you like it, let us know. If you don't let us know. And let us know what other things you want us to explore. I mean, we did Selfina, and today, what are we talking about?
Breast augmentation.
Woo!
Yeah. So we're gonna give the scoop.
I put a little happy anniversary in your cup.
Oh.
Cheers.
So, cheers.
Everyone should be getting their second cup by now.
Yeah. It is at a 2:30 slump. So. Cheers, guys. As you guys hop on, so we can make sure you can hear us now that we're already a few minutes in, if you can drop a comment below, just do #hello so we know you can hear us.
And how are we going to see that, though?
Well, we should see the comments. I hope. Let's see. Can somebody drop a comment below so we know y'all can hear us? And we're going to kind of view it on a couple different screens here to see if we can make sure y'all can hear.
I'm like, can it see me? It can't. Okay, there. Okay.
There we go. Hey, Sarah. Happy Friday.
Yay. Okay.
All right.
So, breast augmentations. But that's not what we call them. We call, who said that? Oh, Sarah.
Adriana.
Oh, Adriana. Hey,
Hello.
girl. Okay. So, breast augmentation is a very long word.
It really is.
A lot of people, what are the popular names?
I think most people refer to it as like a
Boob
boob job.
That
probably the most
sounds
common.
gross, right?
Yeah.
No, that's not feminine.
It doesn't sound very classy.
It doesn't.
We like to
So,
keep it classy around here.
We are going to teach y'all a new phrase that we use here at the office. BAM.
BAM.
Now, it seems like that just stands for breast augmentation, but actually, if you've ever seen Emeril Lagasse and how he used to do that BAM, that's how Dr. Sukar does his breast augmentations, because everyone is just so amazing. He's just like, BAM.
Mm-hmm. So, now you know.
Okay, but now, from now on, when we say BAM, we're talking about a breast augmentation. What is a breast augmentation? Jessica has 7 years of experience in this world.
Yes. So, breast augmentation is augmenting the breast some way, shape, or form, making them larger. So, the way we do it here, the most common way we do it here, is a breast implant. Now, what I'm holding here is a silicone breast implant. And
Isn't it beautiful? Look at the shape.
Shiny.
This isn't one of the brand new ones, is it?
No, this is a fuller profile, and we will talk about different profiles in just a second when we kind of dive into the details. But this is a silicone breast augmentation, so fuller profile, so we'll talk about that.
Yep. So we have a couple to play with.
I'm going to show you guys.
My little brother took one of these sample ones to use as a like a stress ball at work.
Yeah, but didn't he use it on his wrist, like when he was using his mouse?
Yes.
And his keyboard?
So they come in. Just kidding. You don't want to spend that much for
a wrist.
A little rest. Yeah.
Yeah.
Okay, whatever. But so let's just jump in. What are these? So you've dealt with a lot of patients.
Mm-hmm.
What are the frequently asked questions?
So, frequently asked questions for breast augmentation, number one is usually, what's the difference between silicone and saline? That's probably one of the higher ones on the list that we get. So, essentially, they both have the same outer shell, okay? That's a silicone shell. And then inside, for a saline implant, is saline fluid. So, you know when you get an IV or you come in here and you get IV therapy? That bag of fluid, before we infuse it with vitamins, that is saline fluid. It's like salt water, like contact solution, okay? So a saline implant is a flat silicone shell, and then we fill it with a certain amount of saline, and that's how we get the implant.
Correct me if I'm wrong, though. When talking about saline and silicone, when people think of that really fake look that doesn't feel right, that looks fake, because hey, we can still hide it and we don't have to show the whole world our implant size. Saline is going to be that type of breast augmentation, right?
Yes, saline definitely gives more of an oomph kind of look to the breast, so it's definitely going to look
coconuts. Like you have 2 coconuts sitting right there.
Yeah, so it is going to give a more augmented look than silicone implants.
A more fake look.
Yeah.
But
I just like the
I know. But that's not that it doesn't have its place. I mean, of course, Dr. Shukar will not do anyone younger with a saline. Wait, he won't do anyone with a silicone if they're too young. Like I probably wouldn't be able to get silicone because I'm way too. I'm just kidding.
She's only 16, so
just kidding. No, but back then when the silicone implants were so new, they were a lot more dangerous, right?
Well, 28, 30 years ago, there is kind of getting off topic a little. On topic, but not on this line. This line topic. But anyway, so about 28, 30 years ago, there was some controversy with breast implants, and it had to do with silicone breast implants. So they were completely removed from the market, and saline was actually the only thing that was out until about 2006, when the new generations of silicone actually came back out on the market. So these newer generations of silicone implants have been back out on the market for a good, 16 years now? So they've come a long way. So now these are very safe.
I feel totally safe. If they were to rupture, it's not like your body's going to go into shock. Some people wait too long before they come and get it taken out, but that means it's totally okay.
Yeah, exactly. So that was a little bit on saline as far as what the shell is, what it's filled with. Silicone, again, it's the same shell, but the inside is a cohesive or a highly cohesive silicone gel. It's a medical grade gel. So if this implant were to rupture or we were to cut it in half and turn the halves upside down, nothing would spill out or come out into our body, which is awesome. That leads me to my next question, or most frequently asked question for silicone is, what is a gummy bear or a gummy bear implant?
Oh my gosh, yeah. So I remember when I first started here, I kept hearing gummy bear, and I thought it was like a separate brand until one of our breast reps came and actually brought us a bag of orange gummy bears. So then it all kind of clicked. They're not actually gummy bear implants. That's just what the phrase is, because they feel like gummy bears. They have the same consistency.
Yeah. It's a highly cohesive gel. The true gummy bear implants are actually shaped implants, meaning they're shaped like a teardrop. So that's really where the term gummy bear came from. But nowadays, most women, when they hear or see gummy bear when they're doing research, it really is referring to a silicone implant. Is kind of more across the board. And it's just because the gel is so cohesive. So if you had a gummy bear in your hand, you bit it in half and you left half between your finger, that gummy bear is not going to spill out and run down your hand. It's going to stay there. And when you apply pressure to it, it's going to expand. And then when you let the pressure go, then it's going to go back to its original shape. So that's how these silicone implants are.
You amaze me every day.
I'm a visual person, so
that makes sense. No, okay, but thank you, because now I understand. And God forbid someone bites off half of mine, it won't go anywhere.
Exactly, you'll be good. You'll be squared.
Anyway, okay.
So that kind of covers the frequently asked question of what is a gummy bear implant. So
yes, we do carry gummy bear implants.
Yes, we do. Next question is, most patients want to know how the recovery is going to be and what to expect. So when it comes to a breast augmentation, for most patients who work a normal, 8 to 5 Monday through Friday at a computer desk setting job, really can anticipate to take about a 3 to 5 day window of time off from work, meaning have surgery Wednesday, go back to work on Monday. So it's really great to have a short recovery and instant gratification, because
I can definitely attest to that. This was part of the deal. Dr. Sukar did my surgery on a Friday, back on Monday. And everything was good because I listened to my nurse's instructions. That's one thing that will make any procedure you do just 500 times better.
Yes.
Shout out to Andrea and Danielle.
Yes. So that's recovery. Now, one of the other big questions that we get here at our practice is, in 10 years, do I have to replace my implants? Do I need to exchange them? And the biggest thing is, if they're not broken, don't try to fix them. Yeah, so, and that's kind of a common misconception, to need to do an exchange at 10 years or do a tire rotation, as I like to call it. So if everything's good to go, your tissues are great, everything is fine, leave them alone. Now, if there are issues, maybe you've had a couple children since your breast augmentation and you're feeling like tissues are lax or just not in the right place, then that would warrant doing a surgery, like maybe a breast lift, and at that time, maybe exchanging your implants. But if they're not broken in 10 years, don't try to fix them.
Yeah, we've had several calls. They're like, I know it's been over 10 years. It's time. And I'm like, is there something wrong with them? Do you not like them anymore? Do you want to go bigger? Because that's always an option.
Yes.
But that's really not the case anymore. It might have been the case years and years ago before we were born, but we live in a great world.
We do.
Plastic world.
We do. So I really think those are probably the biggest ones. One other thing too is women really want to know where their incision is going to be and how visible the incisions are going to be. So I will tell you, there are several different incision approaches when it comes to doing a breast augmentation. However, the two main ones that Dr. Sukar prefers to do, the first one, prime picking, is called the inframammary fold, and that's the crease underneath the breast. And that's the most common place to put the incision, and probably the best place to put it for most patients.
From an aesthetic point of view, because your boobs are going to cover it more than likely.
It's going to fall in that crease in the curvature of your breast, right where it meets your ribs. So that's the ideal place to have your incision. So that's the inframammary fold. And depending on
the only one I know. So this is a surprise. What's the other one?
So, well, I was going to tell you, inframammary fold, we call it IMF. And actually, Ashley just recently
figured out what I am. So I knew, like, Dr. Sukar would give me information on before and after pictures, and it's inframammary incision or whatever, and I just wrote it. But yesterday we actually went through it, and he's like, okay, so it's right there, right against the body, and then your breast is going to cover it. So I don't know where. Should we look up the Latin No, let's not do that.
We're just going to go in the crease of the breast.
Yeah.
So now the other incision approach that we do here, not as often as the inframammary fold, but we do it quite frequently for certain patients, is called the areola incision or periareolar. So basically...
Lollipop.
No, that's the lift.
Okay,
the circumvertical. We'll talk about that next time, or one of the next times. But anyway, so periareolar basically is like if you were to draw a smiley face, how the mouth just does a little swoop, and that's in the border of the bottom of your areola. So in most cases, it's really not visible once it's healed, but some patients...
when was the last time you were showing off your areolas?
Well, I don't really do that. It's not really a thing I do. So, but either incision approach is, it's a great approach. It's just the preferred placement is in the inframammary fold, and that's really to reduce any type of issues from healing and bacteria too after the procedure. So neither are wrong. They're both great, but they both have their place in the right patient. So that's
really true. I might be silly in saying like, don't do that. I really, everyone is different. Every one of our patients is different. And that's why Dr. Sukar is so awesome. Yes. He treats every case individually. He knows what's going to fit best in your body, and he's going to give you his recommendations, and if you don't take them, you're not right. No, but he's very good at, he sees every single patient before they come in, before they make a decision, tells them what would fit their frame and their body best. And I have witnessed him actually turn patients away because what they wanted was not going to be aesthetically pleasing.
Right, and from a longevity standpoint, going too big it's not good to stress your tissues. Of course, everybody wants most women want larger breasts, but there's a line that you just really don't want to cross and go too big. And when the breasts are getting too wide, it's hard to hide, and it makes you look top heavy and, maybe like you've gained some weight. And so we really want to keep it in proportion with the rest of your body and just, give you just a little oomph to make you feel sassy.
This isn't a Barbie factory. He's not putting 900s and each girl that goes back there to the OR, I can honestly say that his work and his gallery, because I do the marketing and I research other doctors and I see other publications and stuff, Dr. Sukar's results are among the best, if not the best. Yes. I mean, I'm partial, but his breast augmentations are great.
Absolutely. Absolutely. So far, you guys that are on, do y'all have any questions about breast augmentations yet? I'm at my 10-year mark, and mine are so awesome. Awesome,
Yay!
Adriana. Good deal.
Girl, I can't believe you've had them for 10 years.
I know. You're only like 16 years old.
Okay.
So I don't see any more questions so far.
If you have any questions on the replay, let us know, and we can go over those. We'll respond to them. Dr. Sukar might even get on and respond to some questions.
Yes.
But if there's no questions right now, we have some exciting news.
Well, actually, can I touch on one thing really quick?
Yes, you can.
Okay, so I think this is super important when it comes to breast augmentations, and of course, Dr. Sukar and your coordinator will help you pick the right size and everything. But most patients, they ask that, they say, well, I'm an A cup, I want to be a C cup. Well, there's no standard cup size. Right now, you could go to 3 or 4 different places and try on or be sized for different bras, and they're all going to tell you a little different.
Right.
So it's going to be the same thing after surgery.
There's definitely no standard. It's like, have you ever been to, let's say, Guess, and you get jeans from there, and then you go to Zara or H&M, and you're like 5 sizes bigger?
Oh, God.
Just because it's not standardized throughout the entire globe. So that's exactly how it is with bras. And Victoria's Secret
they're
is
notorious
amazing, but they like to pad your confidence and say you're a double D when you're like a B.
Yeah.
So don't go by that. A good practice would be to show how much bigger and how
like the projection
projected
you
want
for.
Yeah.
So we have, when it comes to all implants, silicone and saline, but I'm just going to basically focus on silicone because this is the most selected implant amongst our practice and really across the board in the aesthetics industry. But with the silicone implant, there are different profiles to choose from depending on the projection and fullness, or how you want your upper breast, how full you want that to be naked. Okay, so I actually have 3 different profiles that I wanted to show you guys. There are more than 3 profiles, but these are the most common that we utilize. So this first one is called a moderate plus. So you see it gives projection, but it's not quite as much as this one I was holding a while ago, right? So this is called a moderate plus profile. So this is somebody who wants a little bit more of a natural looking breast, a more natural slope to their breast here. And we call this the upper pole, which is from the nipple positioning upward. Okay, so that's a moderate plus.
I'll hold that one.
Thank you, my Vanna White. Next one. Next one is going to be a high profile. This is probably the most commonly selected profile size that we do here at our practice, just because it's going to give you a little bit more fullness in your upper pole, a little bit more roundness here, okay? And it's going to give you a little bit more projection forward. And that's what most women want, is a little bit more projection forward and a little bit more oomph, but not quite like a saline sometimes, okay? So moderate plus profile, high profile. Now the next one, this is not for everyone, okay? So a lot of times when we're doing an exchange for a patient who's had saline implants for years, and maybe those saline implants that kind of stress their tissues a little bit because it moves around a bit more in the body. A lot of times we switch to this. This is called the ultra high profile. Okay, so this one does stand a little bit taller. You can see that. It has a little bit more oomph to it. Okay, so this one's not for everyone, but it's a great implant to really give you some super mega upper pole fullness, which is going to be in through here. Now, I love these.
I know.
Ultra high profile is my favorite, but again, it's not for everyone.
Yeah, I don't have ultra high.
Yeah, so I'm a UHP girl. I have ultra high profile, so this is my favorite, but it's not for everyone. So anyway, so those are the different profiles. So depending on the projection and fullness that you're looking for, Dr. Sukar will guide you, as well as your coordinator, into which profile is going to be best for you. And it's going to be based on how your natural tissues are right now, where your starting point is. So
you're right. That's another really important point, because me and another coworker have the exact same implant sizes, but we do not look like we do. And that it's all about what you started with. Did you start with anything? Did you start with a little? that's going to determine also how big you're going to be.
Right, because your breast tissues, your natural tissues, are going to interact with this implant, and of course add on top of this. So we take that into account when it comes to doing sizing. So Dr. Sukar and your coordinator will ask you what's your current cup size, or what do you think it is, and what are you thinking that you want it to be afterwards. They'll take some measurements, and then they'll get you fitted for the right implant based on its diameter and projection that's going to fit your natural breast tissues or your breast footprint. So that's how, there's a method to our madness when we're doing all these measurements. And
right, and that's why it really is essential that you come into the office before to make these decisions, to get all your questions answered, and to try on some implants.
Yes, that's probably the most fun part, except for actually having the surgery, is when we do sizing. So you get to look in the mirror, see what you look like with this volume and projection, and really get a clear idea of what look you really are going for. Because you can look at 1,000 different pictures and say different cup sizes, but
yeah,
until you see it on your body, you're not really gonna know.
Right,
So.
and our coordinators encourage you to bring, certain tops that you want to fill out or whatever, so that when you try them on, obviously it's not going to be the same because it's like a blob going on top of you, but you'll get a better idea.
Exactly. Yeah, so it'll make it clearer and more exciting too. So, but I think those are probably the most frequently asked questions, and probably the best amount of information that you can receive when, wanting to plan a breast augmentation. Of course, we dive in deeper into more clinical stuff while you're here, but that's the good fun stuff, I think.
The other question that we get a lot is pricing. So, we want the whole world to be able to have beautiful breasts.
Yes, breast augmentation.
So let's talk about a BAM special.
Yes, ladies. This is so exciting. So we're going to give you some of the details to dangle a little teaser in front of you, but you must comment or private message us to get more details, or call
you
our
can
office.
call, just let the coordinator know that you saw the Facebook Live video.
It has to be mentioned, or you can't get the info. It's very exclusive.
Yes.
So
it's like one of those speakeasies where you have to like.
Oh yeah, like at Grazia.
Yeah, you have to give a password.
Mm-hmm. Gotta call the red.
We should have a password.
We
Okay.
should have a red
You
telephone.
have to say.
BAM Day.
BAM. Yeah.
Okay. But I think that'd be easy, right? You guys can remember BAM Day if you call. So
I was thinking something like the cuckoo flies at noon or something like that.
that'd actually be really funny.
Okay, but that's
We'd have to tell our coordinators the secret word.
I know. Wouldn't that be funny if we didn't? Though?
They're like, okay, thanks for that.
Okay.
Like, no, I need
So,
Hey, really quick. Okay, let me just read this real fast. So Amber says, you ought to do this video in Spanish. I share it on my wall, and most of my friends don't speak English. Well, if they have questions, we do have Ashley here as a Spanish speaker.
Sí,
And
hablo español.
there
No,
you
we
go.
have a lot of people that
Yes.
speak Spanish in the office, and Dr. Sukar tries his
Yes,
best.
you guys would love his Spanish speaking skills.
And he really understands, or he tries to understand and just make you feel comfortable.
Exactly. So we have a very I don't know the term, high population.
Multicultural?
Yes, of Spanish speaking patients here.
Yes,
So
definitely. Letty,
we have a whole clan.
shout out to Letty.
Love it. Okay, let's see. Hi, ladies. And Barbie said, yay! All right. And then, okay, so Barbie said, had my consult 2 years ago and something came up, so never got my implants. Do I need another consult? See more.
Definitely.
Yes,
Things
absolutely.
change, especially in 2 years.
Exactly.
And these prices probably weren't that good 2 years ago.
Exactly.
We are doing major specials.
Yes. So the teaser alert is, if you call and mention that you did watch this Facebook Live, use the keyword BAM Day if you can. That way our coordinators will know. The cuckoo flies at noon.
Yeah.
You could do that. I would actually like to see our coordinators' reactions whenever you say that. Like, what? Anyway, so there's going to be a super mega discount off breast augmentations, and you get to receive something really fun that most patients are dying to have. Should we tell them? That's a clue. Filler for your lips, sister. Filler for your lips.
What? We're giving away free syringes. You get boobs and lips.
Yep, exactly. So
The catch is though, this special is going to be like a 1 day type of thing. So
Barbie says I'm calling now.
yeah, I was gonna say get in while you can. These spots, once we fill the day, we won't be able to do more at this discounted price. You know, Dr. Shukar is very close to being Superman, but he can't quite do like 50 breast augmentations in a day. So
But that man can do it. Do you see our post yesterday about he has done a ridiculous amount of breast augmentations this year, which is only, well, today's February 1st.
Yeah.
So
January,
it's awesome.
Side note, did January not feel like a whole year long? I feel like January
I felt like
was
5
just
years
so
long. I'm like, are we in 2025 yet?
I know.
mean, like,
and with the weather and
oh yeah,
we are definitely dressed for the weather we had yesterday, and then we go outside and it's like,
yeah.
Can we just all get on the same page?
Yeah. This is Texas weather. Texas weather. Okay, what was the code word again? Okay, so my code word is Bam Day, but I think it would be funny if you use what Ashley
The
said.
cuckoo flies at noon.
Yeah. But you can use either one of them because
Mary's gonna kill us.
Yeah, I really want to see what our coordinators say when you call and say the cuckoo flies at noon. Like, that would be hilarious.
Wait, what if they do it for Sarah? Like, the first thing they do when Sarah answers the phone
they're like, the cuckoo flies at noon.
and Sarah's gonna be like,
so Sarah is going to be the one, like, when you very first call our office, that she's usually the very first voice that you hear, so that would actually be quite funny to do that to her. So, we have fun here, so if you want to have fun, do it. I think it would be great.
yes.
And Barbie, yes, make sure you call. That way we can get you situated. So, okay, let's see. Amber said, thanks, you guys have flawless skin. Your treatments. Yes, we definitely do our skincare treatments here.
Sweet.
So, on that note, could we just talk about this? You're the best ever. Along with all you other patients watching.
Oh, Amber, yes.
Yeah. You are the best. Though,
Well, I don't know if everyone has realized this or has been told this, but congratulations, Jessica. You are the spa manager now.
I am.
So even though she knows tons about surgery, the surgery side, she also has a past in all aesthetics in spa work and
yes, over
all
13
of that.
years. I know I don't look old enough to have 13 years experience in the aesthetics industry, but I do.
I can honestly say, like, I was going to tell this to you yesterday, but we started a conversation and then 17 other things happened. But this has been like the first few months that I really have seen the spa doing great things. The spa is offering all kinds of new things. The spa is just like
it's
an
flourishing.
amazing place to be right now, and everyone is being able to see how great Jana is, how great Ruby, Sarah, Andrew, everyone is like shining, and I think that it's in big thanks to you. So, pops for Jess.
Hey Tracy, thank you so much. That's
You're
so sweet.
welcome.
But yes, our spa is, and that's one thing that we're hoping that you guys will drop suggestions below in the comments or send us messages. Because the PS show is definitely something that Ashley and I really want to continue doing more frequently and selecting really fun topics you guys want to talk about, whether it's surgery or spa. Of course, they're all great to talk about, but we really welcome your suggestions of topics you'd like us to talk about so we can dive deep and maybe we'll even do some giveaways.
I was gonna say, and usually when we do these, or the last time we did it, we had a special. This time we have a special. Maybe we can incorporate that.
Yeah.
We'll have to talk to the boss.
Yeah, boss man. Really quick, let's see. Barbie said, do you guys have lip fillers?
Wait,
yes.
so we do get our skin treatments here. Jana hooks us up, and she is on us about our skincare regimen, using the right products, and washing your face all the time.
Yes, absolutely.
Not all the time, like in the morning and the evening.
Yeah, make sure you wash your face twice a day. But yes, we do skincare treatments here. Jana does all of our treatments from dermaplaning to chemical peels, skin pin, which is microneedling, BBL, one of my favorites.
Did you know that this girl has freckles?
Does not. Yes.
There you go.
Yes. So, but yeah, so we
my favorite thing from the spa, and now we're like going into another topic, but we'll talk about these another day.
Hang out.
Yeah,
with us.
but I love, well, obviously I'm a Botox baby. So we started my Botox when I started working here, which was 20 something. And I know how old, just, let's not talk about it. Okay.
You're only 16.
I know. So I am not going to get wrinkles for a while. And of course, yes, Miss Barbie, we do both have lip filler.
Yes. And filler other places.
Mine is a little bit swollen because I just got them done. The top one is a little swollen.
Yeah, just about 2 days ago, right?
Yeah, it was 2 days ago. Yes, Jana created these lips.
Yes, because she didn't.
I did not have an upper lip before, and now it looks so natural that my mom thinks that it was her doing.
Yeah, she thinks it's her
Hey,
genes.
Mom.
Hilda, we love you. You have amazing genes. And then lip filler, is it painful? No, honestly, we use numbing cream for those that get anxious or nervous. So we slap some numbing cream on in the right places and just enough. And then the filler that we use actually has lidocaine in it. So topically,
Lidocaine is numbing.
Yeah. So topical numbing and then numbing that goes inside when the filler is being injected. So it's really
If anything, it just feels a little weird. Like,
yeah, you feel pressure.
Yeah.
Like a little pressure in your lips.
Yeah.
But Jana's amazing. She has such a soft touch
and she's always going to do conservative, you know.
Yes.
I couldn't think of the word. So she's going to put in less
exactly
than, having to.
Because we can always add more. You can't. I mean, you could
I think
dissolve
I'm
some
reaching
of it,
my
but
word quota for the day because I'm not
It is
talking.
Friday.
Okay. Yes.
We need Baileys
We need more Baileys.
in our coffee.
um.
So, but no, Jana's great. She'll make sure you're super comfortable during the injectable.
And Jana is actually like, people go to bars or they go to therapists to vent.
Oh,
I think Jana's great at listening.
Yeah.
Woo.
So if you have a little, you need a vent session while you're here, Jana's amazing. She's an amazing problem solver.
No.
Yeah. So.
So prices for fillers.
Oh yes. Okay. So fillers. We have a ton of different fillers that we use on different parts of the face. So depending on what part of the face we're filling and the level of correction that we need will depend on which filler we're going to use.
Right.
But
I don't really understand. Did you know that like some plastic surgeons, some med spas, they price based on the area? But how do you know how much a person needs?
I think most or more do that more for like Botox than necessarily fillers, I would think. Because I think most of them do, like they'll do one area's X amount of dollars, but I think that's really more from a toxin standpoint. From a filler standpoint,
it's going to be per
it's going to be per syringe. Yeah.
Okay.
Yeah, so most syringes, because that's how filler is injected by us by the syringe, is typically anywhere from $600 to about $650 is about average. There are some fillers that we do that are about $900 to $1,000 per syringe, but those fillers are going to be, on the end of maybe like Sculptra, yeah, and then Voluma. Voluma is a bit more expensive.
One time we put Voluma on my lips and...
Not your lips.
Yeah, we did.
No,
I swear we did.
No way. Jana doesn't do Voluma lips. You're probably. Are you thinking
one
of?
time.
Are you thinking of?
Jana, did we?
I don't know.
Okay.
No, we didn't.
Anyway,
we did cheeks, but yeah. So that's usually Voluma is usually typically used in the cheek area to plump it up. Let's see, ladies' question.
Amber has another question. We love you, Amber, for asking all these questions.
Transgender community. Let's see. Let me just finish reading. Hold on 1 second. Video transgender group in Houston. No, yes. Okay.
Yeah.
Yes.
The only thing is that we want the patient to have a letter or some kind of sign off from their therapist or their psychologist or their treating doctor. Mm-hmm. But we do not discriminate.
Nope. We actually have tons of transgender patients that we've operated on for getting breast augmentation.
Not tons, because it's kind of a new thing. It's not. Well, it's more common, I guess.
But I would say,
a good amount. Yeah, because one person comes and they have a big circle of friends, and
So for transitioning to male to female breast augmentation, and then our patients going from female to male, a breast reduction, almost like a mastectomy, where we completely remove the breast and create more of a masculine look. So yes, both of the top surgeries for the transgendered patients, absolutely.
We have done both. Okay, yeah, you're right.
Yep, we have. And then we do a lot of other things for patients transitioning, especially male patients to female, you know, feminizing their face with fillers, laser hair removal, skincare treatments to get their skin to soften up. So we've got a lot to help them out with. So, and to transition
And just hang out at the office for half an hour and
hang out. Just have fun.
You'll
entertain
you'll
us.
have great girl talk with us.
Yes, absolutely.
Just kidding. That's a joke.
But we do have good girl talk.
Yeah,
so.
we have great girl talk.
Okay, so what else did Amber say? Oh, if you need to talk, I'll read. They always do all these procedures. That's why I went ahead and shared. Awesome. Thank you so much, Amber. We appreciate the share. We really do. Good. Thank you very, very much. You are so welcome. Thank you, Amber.
Candy!
Hey! Hey, girl, hey!
We're gonna see you soon.
Yeah, yeah. I'm so excited to see you and give you a big old hug. It's been a little while. It's been a minute.
How are you, Jess?
How am I? I'm great.
Gorgeous as ever.
I'm gorgeous. No, I'm not.
And
Yes,
she
I am.
said it.
No, I'm just kidding.
Oh my god.
No,
Okay.
I'm totally not. that way.
Anyway, let's
But thank you.
wrap this up because
Yes.
I'm sure.
You guys have to get back to work because you're listening to us undercover at work, I'm sure.
But we would love to do more of these for you. Give us more topics and who you want to see.
Yes, of our staff, because we'll be bringing in special guests on our future ones. So
Yes.
we may even bring the Sook in on one of them.
Oh, and just one final invitation to all of y'all. We do have an event on Thursday, our official Ivy launch party.
Yes, I'm so excited.
Yes.
Y'all,
It's
you
gonna
have
be
to
fun.
come.
And
Yes.
so cocktail attire. No, not cocktail attire.
You can come.
And you just,
However
no.
cute. You know.
But we'll have cocktails.
Yes.
Both the IV kind and the yummy kind.
Yes, we may or may not have a signature cocktail to go with the theme. So,
We will. Okay.
I'll be happy to answer.
Alrighty, guys. Well, do we have a sign off? Should we have a sign off?
Oh, yeah.
Yes, that's it. Okay. Well, we'll be back. Let's not promise how long until our next episode,
y'all need to
but
suggest
give us
topics so
some
we
more topics. Yes, definitely give us some topics. And remember,
Beauty's in the details.
that one's for you, Sook.
Yes. We're looking out for you. All right, ladies, y'all have a wonderful weekend. Happy Friday. Make sure to like and comment below and give us topics to talk about next time and see. Let us know who you'd like to see. So, peace out. See y'all next time.